Okay, so if you press the menu button, we'll just kind of go through this list. The first thing is review. If you click that, you can look at your alarm history and see what the alarms were that were most recently set off. There is a trend graph and a trend table. I personally like the table. If you click that, it will show your most recent vitals, and you can even scroll back to look at them. So if you are having a downtime and you need to go back, or your vitals aren't flowing over, you can go into here, and if you scroll over and highlight report, if you click that, it will print to the printer on the unit in a table format, so it's easier to copy all your vitals over into bar. You can show all leads. I'll show that later. Patient setup. There is the patient category. If you've got a pediatric patient, that's how you change. That'll change all your alarm limits and how high your blood pressure cuff will blow up. We'll keep it on adult for now. You can change your parameters from here and your alarm limits as well. Monitor setup, display options. If you go to that, you can change the brightness. If you're a night shifter and you don't like it super bright, you can make it darker or make it brighter. And then monitor options, here is where you can change your speaker volume, so you can make your alarms louder or quieter, depending on your preference, patient preference. Here's where you can, if you get a patient and there's a pulse tone, that beeping with every heartbeat, you can change the volume here, and that will turn it up and down. You can admit and discharge from the monitors as well, but it's easier from the central station. You have standby mode and privacy mode. Standby will stop all your monitoring. Privacy will just stop the monitoring in the room, but then we can still see it at the central station. And that is pretty much it for the main menu. Next, we'll just go through each of our different options here. If we highlight the heart rate box and click that, you can show all leads. This is helpful to see if the arrhythmia is in one lead, if there's ST elevation in more than one lead. Helpful to just pull up at the bedside. The size ECG, this is how you change the gain. So if your patient is constantly alarming asystole and you know that they're not, this is how you change the size of it. The smaller, usually you'll change all of them, or you can just change per lead. But if you change all of them, the smaller the number, the larger the waveform. But the larger the number, the smaller the waveform. So like this one might alarm asystole because it can't see the little beats. So you'll want to change that size. Lead setup. You can change what lead you're viewing. If you're having trouble with lead 2, you can switch that to lead 3, or whichever lead is giving you the best reading. You can switch those around. In your options button, this is how you turn on the pacer. If they have a pacemaker, then you have to have the pacer detection on. That's how you get your blue spikes. The pulse tone source, so you can see it's set to SpO2, but if we switch that to the ECG, and then we turn our volume on, that's when you're gonna have that tone with each beat. But we don't like that, so we're gonna turn it off. Heart rate alarm. This is how you change all your settings. If you need to lower it or increase it. And then down here, you can switch to, you can add on ST monitoring if you need that extra monitoring. It'll pop up right here. There's arrhythmia monitoring. That should be on full at all times. That's gonna monitor for all arrhythmias. And then your respiratory monitoring as well. The respiratory rate is actually monitored by the movement of the leads on the chest. So that's why this number can be off sometimes if the patient's pretty restless. it interferes with the up and down movement of the chest. Down here at the bottom is the relearn button. You should be relearning your patient. The recommendation is every 8 hours, but at least once a shift, or if you change the patches on them, this can help with any artifact or any trouble reading their rhythm. Okay, the next thing, the blood pressure. If you click this, you've got your interval times where you can change how often that you want them. The venous stasis option is pretty cool. If you've got a patient with a blood pressure cuff already on, you don't need to take that cuff off in order to insert an IV or straight stick them. You can just hit the venous stasis and this will blow up the cuff for 2 minutes. It doesn't blow it up completely to occlude the blood flow, but it does help with getting those veins nice and bouncy. It will automatically turn off after 2 minutes, which is helpful. You don't have to worry about forgetting the tourniquet on or anything like that. I personally like it better than a tourniquet, so it's a nice little feature. The continuous mode, that will continuously take blood pressures. As soon as one's done, it'll take another one. The inflation limit, as you can see, ours is set to adult. You can change it to pediatric. That's not recommended. That just changes how high the blood pressure cuff will blow up to. So if you've got a little old lady that has lower pressures and you want to change it, you can do it from there. But again, it's not recommended because if their blood pressure, if their systolic is over 180, it will not catch that. Flip it back to adult. There's a chime, and then your alarms you can change from here as well. Okay, we'll go through the buttons on the side. The alarm silence button, that will just silence the alarm that's currently going off. The all alarms off button, if you hit that, it will silence all alarms for 5 minutes. Be careful using this, as you can miss things if you walk away from the bedside. Then the patient won't be monitored as well. So just keep that in mind. If you're walking away, then you need to turn that back off so that it will alarm if they go out of the parameters that are set. The code button, if you press this, it will start a timer, and it also turns all alarms off. Don't use this just for a timer because it can miss things, but you hit it and then you'll hit it again to turn the code off. There's a discharge button here that you can hit instead of scrolling through the menu. The print screen button, if your patient's in an arrhythmia and you want to catch that, this will basically just take a screenshot of what is on the screen at that moment, and it will print it to the printer on your unit. Obviously your blood pressure button, and then to mark, this can be used if you want to mark a certain time that you've done something. If you're pushing a certain medication or anything significant has happened, you can hit mark, and that will go back in the record. If you have an arterial line and you're setting it up for the first time, as you can see, we've connected the wires down here, but on our monitor, it's reading CVP. In order to change, we need to change this label here. So we're gonna scroll down and highlight the box, click it, and then we'll scroll down and select pressure labels. When you select pressure labels, you have A, B, C, and D. If you look at our cord down here, we have an A cord and a B cord. Since we're plugged into the A cord, that's why we're green. So we'll scroll over to select the one that's green, click it, and then you can scroll through your different options, whether you want an ART line, a PA line, select which one you want, and that will change it on here. Once we go back to the main screen, we should have the ART line showing up here, and that can make sure that we're getting correct readings for whatever line you have. Okay, in this video, we're going to show you how to get the waveform for the N-Tidal CO2. On here, you can see there's 5 different spots for waveforms, so we have to change the priority of these different labels. So you go to Menu, scroll down to Monitor Setup, and hit Main Screen. When you hit that, you can see there's 6 max channels, but you'll want to go to Parameter Priority. Select that, and then you can scroll down to whatever you want to move. So we'll go down, select Entitle, click it, and then what we need to do is we need to move it above the blood pressure parameter because there's no waveform associated with the blood pressure. Once we do that, select it again, and then go back to your main screen. And that will put your Entitle on the monitor with a waveform.